Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to a session of MRI. Today, inshallah, we will discuss briefly how to read an MRI like a pro. So, my name is Dr. Sayyid Ali Hussain. I'm a physical therapist by profession and I'm a PhD student at Tehran University of Medical Sciences, Iran, and I'm also serving as assistant professor at Department of Rehabilitation Sciences, Shifa Tamir Millat University, Islamabad. And I'm also working as a consultant physical therapist at Equa Shoulder Rehab, Islamabad. So let's start with the name of Allah subhanahu wa ta'ala. Bismillahir Rahmanir Rahim. La hawla wa la quwwata illa billahil aliyyul azim. This is the first revelation, Ikra bismi rabbikal ladzi khalaq. So it tells us that the first commandment or the first instruction that Allah subhanahu wa ta'ala has sent to the Prophet Muhammad sallallahu alaihi wasallam was to read in the name of Allah subhanahu wa ta'ala. So in order to understand what are MRI images, we must understand a basic thing, and that is how the MRI images are made and what is the basic principle of the formation of MRI images. Now, if we can recall from our previous knowledge, the X-rays are based on the density of the tissues. So the denser the tissue visualized in the X-ray, the whiter or the brighter it is. While it is true for the CT as well, but in the case of MRI, it is basically representing the high signal created by the protons present in any region of the body. So we can say that the MRI can be considered as a map of proton energy within the tissues of the body. So we have some variety of images which are really very important for us to understand and to start with. So inshallah we will discuss how to read an MRI using some systematic approach in a way that we cannot miss anything. So here you can see that the bright areas on the MRI, they present high signal. While if we look at the terminology used on the X-rays or the CT scan, they use high signal or bright image is created by high density, whereas here the bright areas are created by the high signal given off by the protons. So if you look at this picture, you will know that the protons in a normal situation, they are oriented randomly, and once these protons are encountering the magnetic field of the MRI scanner, then they get aligned to the magnetic field. Now in the bore of the MRI, the magnetic field is turned off for a certain period of time, and once it is turned off, the protons, they tend to realign themselves to the original or the resting state. So because of this, there is a signal that is generated by the proton, and this signal is received by the MRI scanner and an image is created. So we have two basic type of images. One is called as the T1 and the other is called as the T2 weighted image. T1 is basically representing the areas that are rich in fat, because protons in the fat region, they realign quickly and they have high energy. So for this reason, it is used, or the fat is used to create the T1 weighted image, while proton in the water, they dephase slowly. So this is used to create the T2 weighted image, in which the water is highlighted along with the fat. So the most important slide of today's session is this, that on T1 or T1 weighted images, fat is white, while on T2 weighted images, both fat plus water are white. Because today we are discussing particularly the region that is lumbar spine. For this reason, we have to remember and understand this basic concept that on T1 weighted images, fat is white, while on T2 weighted images, fat and water both are white, and today we will prove these to be true. So this is the systematic approach to the review of spine MRI studies. So the step 1 is that you should determine which sequences or pulse sequences are available for review. For example, I told you T1 weighted or T2 weighted images. In the T1 weighted image, fat is only bright or white. It means that there is high signal coming from the fat. While on the T2 weighted images, there is high signal coming from fat as well as from water. And there is another special image which is called as fat suppressed T2 weighted or STIR, which means short tau interval inversion recovery. So short tau inversion recovery STIR images, they are only highlighting the contents that have more water in them. So I must tell you again, on T1 weighted images, fat is only white. On T2 weighted images, fat and water, they appear bright. While on STIR image or fat suppressed T2 weighted image, only water is white. So T1 fat and STIR only water, while T2 fat plus water. You please memorize this concept because this is going to be applied throughout the spine. We also have a special sequence which is called as post-gadolinium. So post-gadolinium is basically, gadolinium is a contrast agent used for the MRI. So this is the post-contrast images. These are post-contrast images. We normally don't use them in the physical therapy, so let's not discuss them right now. There is another special MRI which is called as MR angiography. It is for the blood vessels. So it is again not commonly used in the physical therapy, and today we are not discussing it, so we will forget about these. Then the second step is evaluation of T2 weighted images. So first you must find out the T1 weighted images, and then you can go to see the T2 weighted images. Sometimes people start with T2 weighted images and they return to T1 images. So there is no hard and fast rule. You can start with T1 weighted images and then proceed to T2, or you can start with T2 and proceed to T1. So here you can see step 3 is evaluation of T1 weighted images. Step 4 is to evaluate the specialized sequences. It can be STIR or it can be post-gadolinium. And then you can correlate the imaging findings with the patient's history and examination findings to determine the most likely diagnosis. There is a saying, they say that treat the patient, not the MRI. That you have to treat the patient. You don't have to treat the MRI. So for this reason, please always focus or consider the patient's history and examination along with the radiological or imaging investigations findings. It is worth mentioning at this point that in about 25% or more percent of individuals who are young, they can have discogenic pathology, but they can be asymptomatic. So for this reason, you must examine the patient and you must take the proper history of their pain or the episode of pain, so you don't miss your diagnosis and you don't treat your patients inappropriately. So this is the same that has been stated into the same slide. So determine which conventional or sorry, specialized images are available. Evaluate T2 weighted images for recognition of areas that has increased T2 signal and are not expected to be physiological, while evaluate T1 weighted images for improved detection of anatomical details and correlation of the alteration in local and regional anatomy. So normally T1 is used for the anatomical details, while the T2 is used for the pathological details. And you can again evaluate the specialized sequences and make a diagnosis. Now in this slide we are looking at some commonly used views of the MRI. Like X-rays, we have some rules. We have a rule of 2 that says that at least you should take 2 views. So AP and lateral most commonly is considered in a lot of situations. So why this rule is being practiced or is observed, or why people consider different views of MRI or CT as well. So I would like you to pay attention to this line. What I am about to say is that a picture is a 2-dimensional representation of a 3-dimensional world. So in reality, any structure in the world is 3-dimensional, while the image that is created either from the ultrasound or the X-rays or the CT scan or the MRI is 2-dimensional most commonly, unless or until it is 3D reconstructed. So for this reason, to see the other dimensions or to see the other sides, we have to acquire some views. So this sagittal view means that the person is divided into right and left half equally, and if it is in the exact midline position, it is called as mid sagittal view. So mid sagittal, exactly in the midline, dividing the body into right and left. While if you deviate from the exact center of the body, let's say a bit right or a bit left, it is called as the parasagittal. So it is called as the parasagittal. While in the frontal view, you have anterior and posterior classification, like a person is divided into anterior segments and posterior segments. So there is no mid frontal. Okay, there is no terminology like the mid frontal. And then we have axial views. The axial views are taken like a cross section. And there is one thing that you need to remember for the frontal as well as the axial views, that these images are reversed images. By the word reversed, I mean that, for example, this is our right hand side where my cursor is. This is right hand side of the physical therapist, but in reality it is the left hand side of the patient. While this is our left hand side and this is the right hand side of the patient. So these are reversed images. The right is left and left is right. Now this is very easy to understand. So there is a question, STIR, STIR, the full form is short tau inversion recovery. Short tau inversion recovery. Okay, so let's come to this again. This is a mid sagittal, exactly in the midline. How I am saying that this image is exactly taken at the midline? Because I can see the vertebral bodies, I can see the spinal foramen or spinal canal, and I can also see this spinous process exactly and clearly. So for this reason I will call it as the mid sagittal image, and this is T1. We should determine why it is called T1 weighted image. So let's discuss why it is called T1 weighted image. If you recall, I told you that in the T1 weighted image there is only one structure that is bright or white, that is the fat. So let's try to see the areas that are white and bright only. So this is bright, this is subcutaneous fat, so this is white. This is epidural fat, this is white or bright. And look at this, this is the CSF, which is made of water, and this CSF is basically black, or in the terms of MRI signal we call as area of low signal. So fat is giving high signal over here, and even in front. But even inside the vertebral bodies you can see that there is a brighter appearance of the vertebral bodies. But the intervertebral disc is not as such bright or white, and this we know for sure that CSF is looking less bright or darker. So for this reason it is a T1 weighted image. And now I will try to tell you all the structures from the posterior to the anterior direction. First of all, this gray portion or this gray line is the skin of the patient. After that we have this white area, which is the subcutaneous fat, and in the subcutaneous fat we do have these blood vessels, which you can see as the dark lines or black lines. After that you have this supraspinous ligament, okay. Then you have these spinous processes, this. So these are the spinous processes, and between the spinous processes these liney areas are basically the interspinous ligament. This is the subcutaneous, this is the epidural fat. This is the conus medullaris. Conus medullaris is the part of the spinal cord where the spinal cord terminates and make cauda equina. So conus medullaris is seen at the level of lower border of L1 and upper border of L2. So these are the vertebral bodies and these are intervertebral disc. Posterior to the vertebral bodies there is the black line, which is basically the posterior longitudinal ligament, and anterior to the vertebral bodies there is a black line which shows the anterior longitudinal ligament. So all these structures are very important for us to understand in order to understand the pathology. So you can pause the video for a few seconds and then you can identify the structures. So we will wait for a few seconds over here so you can identify the tissues. Okay, so let's move to the next slide. So if you see over here that there is T1 weighted image that shows the anatomy of the spine. In T1 weighted images, they can be thought of as a map of proton energy within fatty tissues of the body. So fatty tissues include the subcutaneous fat and bone marrow of the vertebral bodies, and CSF contains no fat, so it appears black on the T1 weighted image. While on the T2 weighted images, I told you that on T2 weighted image, fat and water both give high signal or they appear brighter or whiter. So look at this, this is subcutaneous fat, this is epidural fat, and this is the CSF, which is white, and look at the intervertebral disc, which is white, showing hydration. And this black portion is basically the vertebral end plate on above and below and the annulus. So rest of the structures are the same, and it is again the mid sagittal image because we can clearly see the spinal canal as well as the spinous processes. So complete vertebral bodies. So this is the mid sagittal image of the spine, especially the lumbar spine, because of the conus medullaris, and this is basically telling us about the T2 weighted images of the spine, because the CSF and the subcutaneous and the epidural fat, they are brighter, So for this reason we will call it as T2 weighted image. These are all the same structures that we have discussed in the previous slides, and you can see that the spinal cord is terminating at the normal level, or you don't see any pathology, you don't see any problem in this region, and this is a normal investigation. So we'll not discuss this. I told you all of these things, so let's skip this slide and go to the other slide. And in this slide, please try to see or identify which is T1 weighted image and which image is T2 weighted image. So we will pause here for about 30 seconds so you can identify the weighted images, and then I will tell you. So on the left hand side, this is the T2 weighted image, because the subcutaneous fat and the CSF, they both appear white. While this is a T1 weighted image because the subcutaneous fat is white or bright, but the CSF is black. So you can see these images are almost similar. There are very few or minor differences, and these differences, they help us to differentiate between different structures and to find out anatomical details as well as the pathological details. So like I told you that STIR or short tau inversion recovery images, they are water sensitive, or you can say they are fat suppressed, that the signal from the fat is being suppressed, so only the water is bright. So you can create a combination of images, or you can view the combination of images like T1 only for fat, STIR only for water, and T2 for fat plus water. So you can differentiate between different types of conditions. So normally STIR are used in the spine for identification of spondylodiscitis, which we will discuss in the later slides. So let's recall the anatomy. This is just a short overview of the anatomical details so we don't forget. So we know that the vertebra has an anterior arch and a posterior arch. This is one classification, and if you look at the anterior arch, it is only the vertebral body, while these are the pedicles. This is a transverse process, the lamina, the spinous process, superior articulating facets. There will be, of course, on the underside the inferior articulating facets, and this is the vertebral foramen making the spinal canal. So this is just one classification. There's another classification that we are going to discuss. So if you look at these images, you can see that the nucleus pulposus lies inside, while the annulus fibrosus, it lies outside. And this is the side view. While in the side view, you can clearly see that this is intervertebral foramen. And this is also, so these are intervertebral foramens. These are visualized normally in the parasagittal view. If you can only see the spinous process, vertebral canal, and the vertebral body, then it is mid-sagittal image. But if you are able to visualize the intervertebral foramen, then they are parasagittal images. These are the ligaments that we have discussed. There can be interspinous ligament over here, the supraspinous ligament over here. There can be posterior longitudinal ligament, anterior longitudinal ligament, and another ligament which is called as the yellow ligament or the ligamentum flavum, shown over here. Here you can see this is the yellow ligament, this is also the yellow ligament or the ligamentum flavum. Why it is called the yellow ligament? Because it is rich in fat content. This is a column theory about the spine, that there can be anterior column or the middle column or the posterior column. So clearly you can pause this slide for a certain period of time and you can watch it. In the anterior column you have anterior longitudinal ligament, anterior 2/3 of the vertebral body and the discs and annulus, while in the middle column you have posterior 1/3 of the vertebral body, posterior annulus and posterior longitudinal ligament. And lastly you have posterior column. In the elements of the posterior column you have pedicles or facets or lamina, spinous processes and posterior longitudinal posterior ligaments that are interspinous and supraspinous ligaments. This is the conus medullaris and the chorda equina. The conus medullaris is basically the region of the spinal cord where the spinal cord terminates, and chorda equina is the horse tail's appearance, because all the nerves, they descend from the spinal cord downward. And we should remember the fact that the conus medullaris or the spinal cord terminates at the upper border of lower border of L1 and upper border of L2. This is a cross section. And in the cross section we can see that this is the vertebra that has been cut at the level of the pedicles and the lamina, and you can also see the facets and transverse processes as well, and this is the spinous process. Inside it you can see the epidural fat or the fat around the thecal sac, while these dots or the polka appearance is basically telling you that this level is not at the level of spinal cord, but rather it is at the level of chorda equina. Because in the chorda equina you have these nerves. Okay, this is the cross section in which you can see the outer ring annulus, inner nucleus pulposus. These are the posterior root ganglions, and you can also see the facet joints. These are the inferior articular facets and these are the superior articular processes making the facet joint, and this is the spinous process. Here this is a T1 weighted image, and in the T1 weighted image you can see that it has been taken at the level of most probably L4, L5. So yeah, that's L4, and you can see the outer ring of the annulus, inner nucleus pulposus, the facet joints, inferior and superior articular facet, and this black portion is basically the cartilage making the articular cartilage for the facet joints, and this inside is basically the thecal sac and the chorda equina. So this is the spinous process, and these are the paraspinal muscles, and on the front you are looking at the this is the psoas major muscle, and we cannot see the iliacus at this level. This is taken at the same level again, and in this you are looking at the outer annulus, middle nucleus pulposus, and for the first time you are looking at what is called as the Mickey Mouse appearance. The Mickey Mouse appearance, you can say that this is the Mickey Mouse face and these are the ears of the Mickey Mouse. So I will tell you that this is very important. This region is very important clinically because this region is the foraminal zone or foraminal region. So this is the intervertebral foraminal region over the left side of the patient, and this is the right side of the patient, and these are the exiting nerve roots on the left side, and these are the exiting nerve roots on the right side. And this is the thecal sac. The thecal sac is formed by the meninges, the dura mater, arachnoid mater and the pia mater. So if you have any question, you may ask it right now. You can send a message at my WhatsApp so I can reply it, or if you don't have any question, we will take 2 minutes break and then we will join it. So for this reason I'm pausing the video and we will resume. Okay, so these are all the same structures that we have discussed: the outer annulus, the inner nucleus pulposus, the Mickey Mouse appearance or the head of the Mickey Mouse, and these are the ears. And we will discuss, there are some zones, and we will also discuss the pathologies, and then we will discuss how to find out those pathologies and how to interpret. So these two images, you can see T1 on the left hand side and T2 weighted image on the right hand side. So the same structures that we have discussed, I just put them on one slide so you can compare these slides and you can understand that. Look at the appearance of the bone in T1 while look at the appearance of bone in T2. So there is a clear-cut difference, and look at the difference in the intervertebral disc and even in the thecal sac and the spinal cord, which is not visualized over here, rather we call it as cauda equina. So this is again a cross section taken at the level of L5 vertebral body, and you can clearly see that these are the both right and left ilium bones, and this is the L5 vertebral body. You can see the pedicles, and you can see the transverse process, the spinous process, and you can also see the inferior articular processes of L4. If you look at the cross section of at this level, this is T1 weighted image, and again you can see that this is a classical Mickey Mouse appearance in which you can see the cauda equina. This is T2 weighted image because this is more brighter, and these black dots, they are telling us the cauda equina or the nerves that are descending, and here we are looking at the foraminal zone or the space which is intervertebral foraminal space. These are the same images taken at the level of L5 vertebral body. Now this is a tracing or image of the mid sagittal region of the lumbar spine, because in this image we are looking at the vertebral bodies, and this is thecal sac or the vertebral canal, and posterior to the vertebral canal you can see the spinous processes and subcutaneous fat as well. So this is T1 weighted image. Why? Because in the T1 weighted image you don't see the CSF, and you can clearly see the vertebral bodies of different vertebrae. This is the sacrum, which is the fused one. The spinous processes, because you can see the midline structures, so for this reason we are going to call it as mid sagittal image. This is again a mid sagittal image, but this is T2 weighted. Why? Because if you pay attention, subcutaneous fat and the CSF both appear white, and for this reason we will call it as T2 weighted image. All the structures that we have previously discussed can be visualized over here. There is a slight pathology on the level of L5S1, but let's not discuss it right now. So this is the comparison of T1 versus T2 weighted images or mid sagittal images that are T1 and T2 weighted for the lumbar spine. Now you can see that this is a parasagittal image. Now parasagittal means adjacent to the sagittal or adjacent to the midline. This is very important for us to understand that in the parasagittal images we have to look for the subcutaneous, epidural fat, and apart from the epidural fat we have to see a black portion inside, just like these yellow portions. These are the dorsal root ganglions, or you can say these are part of the nerves. So sometime there can be far lateral or lateral disc pathology that compresses these exiting nerves, and for this reason patients may have some pathology. So this is a parasagittal image of the lumbar spine. This is a T1 weighted image, because, or is it really T1 weighted image, or is it T2 weighted image, or it is fat suppressed? It is a bit tricky, because I personally believe that this is most probably an image that has been taken, and it is a specialized image in which fat and signals from the water both are suppressed, because here you can see this is the fat that has been suppressed. You cannot see the fat over here, and there is no water, so we cannot see whether it is STIR, because it is not mentioned. So most probably it can be STIR, because no structure, we cannot see the CSF, because this is not the region of the CSF. So for this reason it can be STIR, or it can be any other specialized sequence. But what about this one? I believe this one to be T2 weighted image. Why? Because we are looking at the subcutaneous fat, which is white, as well as we are looking the vertebral bodies that are hydrated, and for this reason we can conclude that this is a T2 weighted image. But because this is a parasagittal image, so please pay attention to the detail, that is intervertebral foramen, from which you can see the dorsal root ganglion, and this dorsal root ganglion appears as the black portion in the intervertebral foramen level. So over here they say that this is T1 and T2 weighted image, but I believe there will be a mistake, because you cannot see the subcutaneous fat, or maybe this is T1 weighted image because this is parasagittal, so you are not looking at the fat, rather you are looking at the muscle area itself. So it is also highly possible, because I forgot to add the legends, so again it is sometime difficult, so you can make some mistake. So let's look at the pathology, or how to find the pathology. So these are very good drawings that tells us about the intervertebral disc, and you are also looking at this green color's thecal sac containing the cauda equina, and you are looking at the roots that are exiting, and this is intervertebral foramen zone, or we will discuss these zones as well. Some people call it as central and foraminal zone and far lateral zone, and some people divide it into different zones. So here you can see these are nociceptive fibers, because whenever there is pathology in the disc, the nociceptor fibers, they start to send the signal of pain to the body, to the brain, and then the people perceive pain. And here you can see if this is the frank disc pathology or bulge, in which the shape of the nucleus has been disturbed. You can see that this is the normal, and look at the shape of the nucleus over here, which is pathological, while this is disc protrusion, this is disc herniation, this is disc extrusion, and this is disc free sequestration. These are different pathologies. So I will tell you again, so please pay attention that this is a normal disc. When the disc bulging occurs, the shape of the disc changes. This is called disc bulge, and it is causing compression of the spinal nerve at the level of intervertebral foramina. Okay, over here this is because the last or the outermost ring of the nucleus is retained, so this is disc prolapse, and in this picture you are looking that it can compress the exiting spinal nerve roots as well as the spinal nerve, and it is not in the midline. Again, it is the level of the intervertebral foramen. Here you can see that this is called disc herniation. Why? Because the outermost layer, here you can see that the outermost layer is intact, but here the outermost layer has been broken down, and this is called as disc herniation, while this is called disc extrusion, that it has crossed the boundaries of its, its region. It crossed its boundaries and then it is entering into another region. For this reason it is called as disc extrusion, but it is continuous with the inner nuclear material as well. While here you can see that the nuclear fragment has been broken down and there is a break between the inner and outer nuclear material, so it is called as free sequestration or simply sequestration. So these are the different pathologies. These are 4 pathologies. Sometimes people write 5 pathologies. So it depends which classification you follow. Here you can see bulging. So D-shaped vertebral disc is called as the bulging, or then there can be protrusion in which the outer layers of the annulus they are intact while the disc is D-shaped or deformed. The next stage is extrusion, in which the outermost layer is broken down and the nuclear material it moves out, while this is the sequestration or the free sequestration, in which there is a break between the inner and outer nuclear material. So here again you can see there is a difference between herniation and bulging. In the herniation, the outer layers are broken down. So these are very easy to remember. So if you look at this slide, this is again a very important, like other slides, that you can divide the region of disc into the central zone, the subarticular zone, because this is at the level of the facet joints. So subarticular, and lateral to the subarticular you have the foraminal zone, and lateral to the foraminal zone you do have extra foraminal zone as well. These are again 4 stages: degeneration, prolapse, extrusion and sequestration. I believe now you have a clear-cut understanding of these. So please look at this. On the level A, or in the picture A, we are looking at the bulging, protrusion, extrusion and sequestration, while on the picture B, this is very important, that this is herniation. Why we are calling it as herniation? Because the outermost layer of the annulus has been broken down. Can we see them on the mid-sagittal or the parasagittal images? No. We can just look at the pathology and we can tell that in the mid-sagittal region or in the mid-sagittal images, T2 weighted images, there is a pathology at L5S1 disc. But what type of pathology? We cannot tell it, because for this we need to look for the axial view, and this is the trick. So this is T1. First you look at the T1 weighted images, then you move to the T2 weighted images, and in the T2 weighted images you can see that there is clear-cut compression of the thecal sac because of the disc. So what type of pathology is this? Is it a central pathology, or is it a far lateral zone pathology, or is it a intervertebral foraminal pathology or subarticular pathology? We cannot understand it unless we see it on this. So in this, if you look at this axial view, this is a T2 weighted axial view. I repeat, this is a T2 weighted axial view, because why? You are looking at half of the face of the Mickey Mouse and half of the face of the Mickey Mouse is white. So it shows that the CSF is bright. So when the CSF is bright, it means that this is T2 weighted image, because posteriorly you can also see that the subcutaneous tissue or subcutaneous fat is also white. So these fat and water are white, so it is a T2 weighted image, and you can see that the nuclear material is covering the right side. I told you these are the reversed images. So this nuclear material is compressing the middle portion as well as the lateral part. You can say it a bit lateral part of the thecal sac, and this is the subarticular zone that is compressed, and you cannot see the exiting nerve roots. Similarly, for the very same patient, the MRI was repeated 1 year after, and you can see that there has been reduction in the disc. This was disc herniation. So there has been a reduction in the disc herniation, and you can see from the extent that it has been treated conservatively, and you can also see that the face of the Mickey Mouse has been restored to somewhat extent, and these are the exiting nerve roots on the left side and these are on the right side, although there is a bit of compression, but still this is far much better than the upper image. So this is for you to find out. I know that on the top you can read it, but please look at this. This is T2 weighted image. This is T1 weighted image, and in the T2 weighted image you are looking at the intervertebral discs that are hydrated over here, but this is degenerated and this is degenerated. While look at this is a pathology. I don't know what type of pathology, so let's go to see the axial or the cross section. When you go to the cross sectional view or the axial view, this is the left hand side, so there is a central to left disc bulge that is compressing the exiting nerve root and the thecal sac. So in these type of patients, you know, whenever there is thecal sac involvement, the patients, the test, there is a sign which is called as a thecal sign test, which is positive. So the thecal sign test positive or the thecal sign means that whenever the patient cough or sneeze, he or she is going to experience pain. So this is called the thecal sign test, and this is positive because in this patient there is compression of the thecal sac as well as there is compression of the chorda equina. Why there is no compression of the spinal cord? Because the spinal cord is terminated at the level of L1 or L2 in the form of conus medullaris. Good. So here you can see all the structures, and this is a mid sagittal image. Okay, and we are looking at pathology, which is a disc bulge, but what it is doing, we need to look for the axial view. So over here, look at the wavy appearance. If you see the wavy or the kinky appearance, it is pathological, and clearly you can see that there are multiple disc pathologies in this patient, and this is somewhat not 100% but almost you can say it is a mid sagittal image, T2 weighted. Okay, we have one other pathology we are going to discuss in the next slides. So please pay attention to all of these structures, that these are the neural foramen or intervertebral foramen through which the nerve is going to exit outside, and these are the exiting nerve roots on either side. This is the right side of the patient and this is the left side of the patient, and this is the thecal sac, and these are the facet joints, the spinous processes and the lamina, the paraspinal muscles, the disc, inner portion is nucleus and outer is annulus. And you can see that there is disc herniation which is causing compression of the central part of the thecal sac. Why? Because there should be a white line running on top of the head of this Mickey Mouse. Okay, so if you cannot see just like this white portion, if this white portion is missing, you will say that there is compression of the thecal sac. Like you can see, this is the white portion onto the right side of the patient, while there is compression on the center as well as the left exiting nerve roots. So this is the level of pathology. So I told you that we do have vertebral end plates on both sides of the vertebral body, superior and inferior part. So you have vertebral end plates. These are cartilaginous in nature, and whenever there is axial loading, then there is invagination of the nuclear material inside, which is called as the Schmoll's node. So this is also a pathology that shows that there is more axial loading. So typically or classically the Mickey Mouse appearance can be seen. So let's forget this and go to the next slide. So these are the same structures, but now if you have a digital image of the MRI, you can open it through a software, most likely the DICOM or micro DICOM or other softwares, and you can measure this dimension, that this dimension should be 20 millimeter. If there is decrease in this dimension, then it is called as vertebral canal stenosis. So clearly, disc herniation causing vertebral canal stenosis, compression of the thecal sac, and in the other view or the axial view, you can find the pathologies as well. So let's take 5 minutes break and then we will continue. Okay, so here you can see that this is axial view. Yes, it is T2 weighted image, and we are looking at the classical Mickey Mouse appearance, and this is the parasagittal image of the lumbar spine. You can see the epidural fat and this grayish portion which is the posterior root ganglion. Okay. So these are the same things that we have discussed. There can be, this is the neural foramen and the exiting nerve roots. This is the thecal sac containing the chorda equina, and over here this is all the nerve root. These are the pars and the lamina and the spinous processes. So this is taken at the level of the facets. Here you can see this is a T2 weighted image, and in the T2 weighted images you can identify a very beautiful image of the conus medullaris. You can also see the chorda equina, and you can also see the vertebral bodies, intervertebral discs, which are well hydrated. So when the discs are hydrated, it means that they are healthy, and there can be a few reasons of disc dehydration. One is aging, which is a normal phenomena, or because of the aging process the discs, they become dehydrated. The second is called degenerative disc disease, in which the height of the disc is reduced and the water content of the disc is lost. And thirdly, there can be discogenic pathology, that can be protrusion, extrusion, sequestration or whatsoever. So in these conditions there can be dehydration of the disc. So the more the disc is hydrated, the more the chances of discogenic pathology, because they exert pressure in all directions. But when the discs they become dehydrated, there are very few chances of discogenic pathology. So for this reason you will not see, or you will rarely see, discogenic pathology in the geriatric population, while you will commonly see the discogenic pathology in the young population. So these are the parasagittal images, or this is the parasagittal view of the lumbar spine, T2 T2 weighted image, and in this you are looking at the spinal nerve roots or the posterior root ganglion as well as the epidural fat. So this is a normal view of intervertebral disc at the level of L1 and L2, and this is an axial image, especially T2 weighted image. And here you can see this is the white portion which is showing the CSF. The outer portion is the thecal sac lining or the boundaries of the thecal sac as well. Now let's look at this. This is a pathology, and it is compressing the thecal sac so much so that the diameter of the vertebral canal has been reduced or it is less than 20 millimeter. So it is causing the compression onto the thecal sac. So what type of compression? Either central or the foraminal. We have to look for the axial images. So this is called the Schmoll's node. So basically the protrusion of the disc into the vertebral body is called as the Schmoll's node. So it shows that there is axial loading, vertical loading. And why there is vertical loading? Because of the straightening of the lumbar spine. So if the curvature of the lumbar spine is lost, it means that there is axial loading, leads to more compression of the vertebral bodies and the discs. So for this reason, if somebody is osteopenic or osteoporotic, you will commonly see these changes in those population, especially in the female population. So here you can see that lumbar disc degenerative disease can be seen mild, moderate at these two levels and severe at this level, that the disc height has been completely lost. Here is moderately lost and here is mildly lost, and the disc is dehydrated over here, more dehydrated over here, and completely gone over here. So this is most likely T2 weighted image. Now this is a disc bulge and it is compressing the right intervertebral foraminal region, compressing the exiting nerve roots. If this image is taken at this level, so this is L5 and this is L4, so this level is at the level of L4, L5. Disc bulge causing compression of the exiting right sided nerve roots. Here you can see disc protrusion. It is central and as well as left. So this is central plus left compression onto the spinal, onto the thecal sac as well as onto the left exiting nerve roots. This is extrusion, that the nuclear material has moved and outside and has been detached. So here you can see this is disc extrusion. So the nuclear material is compressing very severely onto the thecal sac. So this is again the lumbar disc extrusion. Look at the shape of the disc, so bad shape, and it is compressing the central portion of the thecal sac. So for this reason it is a central disc protrusion. Again this is a central to left disc protrusion causing the compression onto the exiting nerve roots. This is posterolateral or just the foraminal, subarticular to the foraminal disc protrusion causing compression of the exiting nerve roots. This is the schematic of the posterolateral disc protrusion. We do have posterolateral or posteromedial disc bulge, but nomenclature for the physiotherapists, so they are used most commonly for the therapeutic purposes. We do have foraminal disc protrusion. So at the level of foramen, you can see exiting nerve roots are being compressed at the level of the foramen. This is the presentation of the foraminal disc protrusion. Then we have far lateral. So lateral to the neural foramen is called the far lateral disc protrusion. So again they can be seen onto the parasagittal images of the lumbar spine. Here you can see far lateral. This is the foraminal region. From this, if you go more lateral, you will go to the far lateral disc protrusion. So this is the schematic of the far lateral disc protrusion. Here you can see STIR image that shows the edema in a stabbed patient. Look at the edema. STIR is short tau inversion recovery. So for this, only the signal that is coming from water is white or bright. So look at the discs that are very much hydrated. Look at the thecal sac and the CSF, hydrated or fluid, while look at this, which is the edema all the way down. So this is edematous. So this is mid-sagittal image of the lumbar spine showing no pathology. These are all the zones that we have discussed: central, subarticular, foraminal and extraforaminal or far lateral zone. The same central, this is paracentral or the subarticular, this is lateral and this is far lateral. Now look at this, that if you look onto this image, this is a T1 weighted pathology of the spine that shows two regions. This is the region 1 and here is the region 2 of abnormal low signal. So if we have abnormally low signal on T1 weighted image, we have to see it on T2 as well. So see, these are the low signals on the T1 weighted image, and if you see on the T2 weighted image, it shows that this is water, because on T2 fat plus water is bright. So this is basically pathology of the spine. So it can be vertebral body infection or inflammation. So it can be spondylitis, while here you can see this is spondylodiscitis, that it is seen on T1 image. At the same time, you need to look for the STIR image to find out the pathology, which is called the spondylodiscitis. This again T1 versus STIR image showing the high signal of the spondylodiscitis. These are all the references. Thank you very much. And now once we finish this, we will move to the question and answer session. Thank you very much.